Pramoxine is used to temporarily relieve itching and pain caused by minor skin irritation such as minor burns, cuts, scrapes, sunburn, eczema, insect bites, cold sores, or rashes from poison ivy, poison oak, or poison sumac. Some products containing pramoxine are also used to temporarily relieve the itching and discomfort from hemorrhoids and certain other problems of the genital/anal area. Pramoxine belongs to a class of drugs known as local anesthetics. It works by numbing the skin to block the feelings of pain and itching. This product may also contain other ingredients including skin protectants. Read the product package for more information. Do not use pramoxine for skin irritation in children younger than 2 years or use pramoxine for hemorrhoids or other genital/anal conditions in children younger than 12 years unless directed by the doctor. If you are self-treating with this medication, it is important to read the package instructions carefully before you start using this product to be sure it is right for you. This medication is for use only on the skin as directed by your doctor. Do not apply on severely broken skin areas such as open wounds, deep cuts, or serious burns. If you are self-treating, follow all directions on the product package. Gently clean and dry the affected area before applying the medication. If using a lotion, spray, or foam product, shake the container well before use. Apply to the affected area as directed by your doctor. For skin irritation, apply up to 3 to 4 times a day. For hemorrhoids or other anal conditions, apply after each bowel movement or up to 4 to 5 times a day, or as directed by your doctor. Do not use inside the rectum. Wash your hands immediately after use. Do not use on large areas of the body or more often than directed. Do not cover the area with waterproof bandages or apply heat unless told to do so by your doctor. Do not get the product in your eyes, nose, ears, or mouth. Stop using and tell your doctor if your condition worsens or does not improve within 7 days. If you think you may have a serious medical problem, get medical help right away. If you experience burning or stinging, let your doctor or pharmacist know. Your doctor has determined that the benefits of using this product outweigh the risk of side effects. Serious allergic reactions are rare, but seek medical help if you notice symptoms such as rash, swelling, severe dizziness, or trouble breathing. If you notice any other effects, contact your doctor or pharmacist. In the US, call your doctor or report side effects to the FDA. In Canada, call your doctor or report to Health Canada. Before using Prax Lotion, make sure to tell your doctor or pharmacist if you are allergic to pramoxine or any of the other ingredients in the product. This product may contain inactive ingredients that can cause allergic reactions, so it's important to talk to your pharmacist for more details. Also, be sure to inform your doctor or pharmacist about your medical history, especially if you have deep/open/puncture wounds, broken/damaged/blistered skin, animal bites, or serious burns. If you are using Prax Lotion for hemorrhoids and experience bleeding from the rectum, stop using it and consult your doctor promptly. Before undergoing surgery, remember to inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, only use this medication when clearly needed and discuss the risks and benefits with your doctor. And if you are breastfeeding, consult your doctor before using Prax Lotion. It's important to be aware of how different medications might interact with each other, as this can affect how well they work and increase the risk of side effects. Make sure to keep a list of all the medications and products you use, including prescription and over-the-counter drugs, as well as herbal products, and share this with your doctor and pharmacist. And always consult with your doctor before making any changes to your medication regimen. If Prax Lotion is swallowed, it can be harmful. If someone takes too much and experiences severe symptoms like passing out or difficulty breathing, it's important to call 911 or a poison control center immediately. In the US, you can call 1-800-222-1222 for your local poison control center, and in Canada, you can contact a provincial poison control center. Make sure to attend all your scheduled medical and laboratory appointments. If you use Prax Lotion regularly and forget a dose, use it as soon as you remember. If it's close to the time for your next dose, just wait and use it at the regular time. Don't use extra to make up for the missed dose. Keep Prax Lotion at room temperature. Different products may have different storage requirements, so be sure to refer to the product package or ask your pharmacist for instructions. Always keep medications out of reach of children and pets. Do not flush Prax Lotion down the toilet or pour it into a drain unless instructed. Dispose of the product properly when it is expired or no longer needed, and consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.